Hello people, let us look at measles in this video. Measles is basically caused by a virus. It's an RNA virus. It comes under paramyxoviridae. So if you remember our virus classification, in that we have seen measles here. See, measles, rubeola. This one here, it is coming under paramyxovirus, under myxoviruses, which is a RNA virus. Okay. So this is a viral disease. So basically, what is the incubation period? Around 10 days, you can remember. It affects 6 months to 3 years child more, but it can affect in any age. It's a human-to-human transmission. It's a respiratory disease, so the source is droplet. Usually, it is clinically it manifests, right? So there are no carriers, not much iceberg phenomena. It is, these people are communicable to others. They can spread the infections to others 4 days before the rash appears and 5 days later. Okay. So guys, it is a communicable disease. So you remember, right, in communicable diseases, we have seen respiratory diseases and we have seen intestinal infections, skin and all that. In respiratory, under viral infections, measles is there, right, rubeola. So that is what we are looking at now. Communicability. Then it gives lifelong immunity, looks like. And this is a fever with rash. There are so many fevers with rash, right? So you should be able to differentiate from other conditions. We will come to that. Then here you will have some Koplik spots. That is the pathognomic feature. Bluish white they will be opposite lower second molar, that is in the buccal mucosa, in the mouth. So it is also called as rubeola. So we said 6 months to 3 years child, right? Mostly affects. It is unusual before the age of 4 months. Before 4 months, it is not going to be there. That's good, right? That's why they said 6 months to 3 years. And mild in the next 6 months. In the next 6 months, if it occurs also, it's mild. Looks like it's protected. The mother's antibodies are protecting, is it? Look at the phases of measles disease. You have the prodromal. Then you have the eruptive phase and convalescent stage. Guys, if somebody asks you the natural history of the disease, you'll have to explain all this, because in PSM epidemiology, this only they will ask. Natural history of disease only they will ask. So you'll have to explain there are 3 phases: prodromal phase, eruptive phase and convalescent phase. Okay. So let's look at this. Prodromal phase. So catarrhal phase, so mucous membrane is affected, is it? So here the person can have fever, Koplik spots, buccal mucosa we told you, maculopapular rash, opposite the lower second molar and then other sites in the mouth. So remember, Koplik spots in the mouth. And also you can see rashes behind the ear, retroauricular they said, right? Then there can be coryza. Coryza is inflammation of the mucous membrane. We told you mucous membrane is affected. Guys, what are we looking at? Prodromal phase of what? Of measles. Okay. Coryza and nasal discharge, redness of eye. Okay, this already we told you. Redness of eye, conjunctivitis can be there in prodromal phase. So viruses in the prodromal phase, it is affecting what and all, guys? Buccal mucosa, eye, conjunctivitis, it can cause red eye. Then what else? Nasal discharge, fever, all this will be there. Okay. Then eruptive phase, 3 to 5 days after the onset of the disease. You can better see it in daylight. Pink, blotchy, irregular, macular erythema. Let us see this photo first. Wait. What is there in this photo? Note the rash has spread all over the body. Okay. So this is the eruptive phase. What will be there here? Irregular macular erythema, pink, blotchy. It fades on pressure. See, it fades on pressure. Important, remember. Looks like a diagnostic feature. It fades on pressure, quickly darkens and blends into large red patches of varying size and shape. Did that make any sense at all? So pink, they are telling it is becoming large red patch once you put pressure, looks like. Face and areas behind the ears, retroauricular area, yeah, we told you, right, are the sites of its first appearance. So here, this is where they are telling it is coming, is it? Retroauricular. So first what was affected was the buccal mucosa. Then only it is coming to the retroauricular area. Okay. So you can write here Koplik spots, all this inside the mouth and all. Then after this, the next stage, eruptive phase, that is where it is going from behind the ear, the rashes, behind the ear, rash, scalp, retroauricular and all that. Let's look at it. So face and areas behind the ears, retroauricular area are the sites of its first appearance. Then it spreads to the neck, the trunk, the limbs. So you can see here the trunk is affected. Then it is frequently accompanied by cervical lymphadenopathy. So what will be there here? Cervical lymphadenopathy. So guys, we have looked at the natural history of disease measles. We are looking at it actually. We have finished the prodromal where you saw the Koplik spots and the eye is also affected here. Right, then you have nasal discharge, etc. Fever. Don't forget fever. Then now we went to eruptive phase where we saw from there or behind the ear, scalp, then neck, and then trunk. Everything is affected. That's the eruptive phase. There can be cervical lymphadenopathy also. What is the third phase? What is the third phase, guys? Convalescent phase. Some kind of a healing looks like. What is there here? Note the light brown staining pigmentation left behind as the rash has gone away. Here rash is gone and some light brown staining is there, they are saying. Here can you say the rash? Yeah, it's more red here. Correct. And here it's more brown. Yes. Not going into much details of that. Post-measles people can have a lot of weight loss, weakness, etc. Anyways, we have come to the immediate complications of measles. Then we have the late complications of measles. Let us look at the immediate complications of measles. Here you remember important ones only. Don't go into depth of everything. Otitis media is the top, but here they didn't write serous otitis media, but in there they had written serous otitis media. Serious, they're saying otitis media is the common complication. Okay. Then this one, giant cell pneumonia, which can be fatal. In AIDS patients it can be there. Measles pneumonia in AIDS may occur without any rash and it often proves fatal. So this fatal word is coming for this pneumonia, giant cell pneumonia. Okay guys, where will you see giant cell pneumonia? Post measles, yes, or it's a complication of measles. Okay. Then vitamin A deficiency we told you. Okay. Then what else? There are a lot of other things here. Something called black measles has a fatal outcome. Hemorrhagic measles, if there is hemorrhagic. Anyways, encephalitis can be there also. That's also dreadful. So guys, did you understand that most of these complications are kind of fatal, except that serous otitis media and vitamin A deficiency, isn't it? Okay. Then let us look at the late complications of measles. There can be subacute sclerosing panEncephalitis. This you have to write in the exam, SSPE. Subacute sclerosing panEncephalitis. So it is a universally fatal disease. It's really sad, right? It's a fatal condition. There can be myoclonic jerks here. Okay. Mental deterioration. It behaves like a degenerative disorder, they are telling. Okay. So what is the late complication? SSPE. What is SSPE? Subacute sclerosing panEncephalitis. Encephalitis, brain tissue. Pan means or everywhere, right? Everything involved. Sclerosing, subacute. Why is it subacute? What do you think? Subacute sclerosing panEncephalitis. Subacute actually is something between acute and chronic. Okay. Treatment of measles, there is no specific treatment as very typical things about viral infections, no specific treatment. So it is going to be symptomatic treatment just like other viral infections. General measures, you will isolate the person, right? We told you how long he is communicable, right? Then you can give cough sedatives, nasal drops, antipyretics to reduce the fever. Any attention you need to give to the eye and mucous membrane of the mouth. Antihistaminics for itching, if there's itching, and fluid and all you will maintain. That's it. Vitamin A you will administer to reduce the morbidity for measles. Vitamin A you give, okay. So don't forget, for fever you will give treatment. Then if there's any itching you will give treatment for that. Then proper fluid you will maintain, dietary intake. If there's eye anything problem you look at that. Then nasal drops they are giving because nasal discharge was there. Sedatives, cough sedatives. If there is cough they are giving, or what is this? Okay, then if there is a superimposed bacterial infection, then only they will give antibiotics. Okay. Antivirals, they have not found to be of any use. So that's why they are saying no specific treatment. Gamma globulins, hyperimmune gamma globulins and steroids are of doubtful value. They really don't like this. So let's make this a gray. Why waste time on this? Read the actual treatment. Actual treatment is what, guys? You isolate the person, you give them fluids, dietary intake, if there's any problem, attend to it, antipyretic to reduce their fever, antihistaminics if there is itching, nasal drops, vitamin A, don't forget vitamin A, okay guys, don't forget vitamin A. Then prophylaxis, how can you stop measles from occurring? You have all the immunization. So you have active immunization, vaccine at 9 months for the 9-month baby. Then again 15 to 18 months it says here in the form of MMR. Let's look at this way. We already have a separate video on measles vaccines, live attenuated vaccine it is. It is Edmonton Zagreb strain. It's a lyophilized vaccine, powder vaccine, which they will add sterile water or distilled water to reconstitute this vaccine, and they'll give it subcutaneously 0.5 ml. Okay. How are they giving it? Subcutaneous injection. National immunization schedule just recommends 2 doses of MR, 9-month first dose and 16 to 24 months second dose. Indian Academy of Pediatrics recommends 3 doses though. Okay, immunoglobulins are also available for passive immunization. You have immunoglobulins also. Okay. So when will you give this? For the contacts. You will give passive immunization. That's all, people. We have looked at the prophylaxis also. Just remember that, guys, this measles vaccine is live attenuated vaccine, so you should not give an immunocompromised people. Of all the vaccines, right, measles vaccine has the many contraindications and complications that are listed. Compared to other vaccines, this one has some more adverse reactions and complications. So measles vaccine in the ILR, where is it stored? Down. +2 to +8 degrees centigrade, right? That is the ideal storage temperature for all vaccines, you can remember. Measles is in down it will be, in ice-lined refrigerator. In normal refrigerator, it will be a different position. Don't learn that. Ice-lined refrigerator position you learn, okay? So how will you do the diagnosis, guys? How do you know it's measles? Basically, guys, clinically itself you can say, we will come to the differentials, wait, okay? But otherwise, if you do lab diagnosis, what will you find? You will find measles specific IgM antibodies. You will find antibodies. You will see, you can do ELISA and hemagglutination inhibition. Hemagglutination inhibition is there even in influenza, right? So you can do this. For detecting measles antibodies. Today it has become possible to isolate the virus from nasopharynx or blood, especially during the acute stage. This is again unnecessary. Why would they do this? But anyways, if you want, you can do all this. So you have to take nasopharyngeal swab or something, isn't it? Coming to differential, guys, how can you differentiate it from other conditions? That's important, right? See, another supposedly viral infection of infant and toddlers, that is Roseola infantum. Okay, there is some Roseola infantum. You should not confuse this with measles. Roseola subitum, 5th disease or something. Roseola subitum, 5th disease. And Roseola infantum of human herpes is the 6th disease. Should be able to differentiate with this because this also appears around the same age. It is a viral infection of infants and toddlers. So this is also a viral infection of this also affects infants and toddlers. Okay. So this they are blaming which virus? Herpes virus. That's a DNA virus. So you should definitely be sure whether it's a DNA or an RNA virus at least, right? The pink macular rash of the infection usually appears on the trunk, neck, proximal areas. Okay, trunk. Let's look at this. Roseola infantum. Trunk, neck, proximal areas of the extremities only. It lasts just for 24 hours. Next, look at rubella, guys. Rubella, the rash is mild. They are saying it is discrete and it is there is significant posterior occipital lymphadenitis. In this one, measles, they said cervical lymphadenitis, right? Cervical lymphadenopathy. Here they are saying occipital, posterior occipital lymphadenitis in rubella. Prodromal phase is slight and short in rubella. What about infectious mononucleosis? It is also caused by Epstein-Barr virus, isn't it? This rubella is also rubella virus only. Infectious mononucleosis or glandular fever. It is also having rash. Okay. What are they writing here? Interestingly, the rash often becomes manifest following administration of ampicillin. So if you give ampicillin to these people, the rash becomes manifest. The rash often becomes manifest following the administration of ampicillin. That is what they have written about. Infectious mononucleosis. And here also there will be fever, generalized lymphadenopathy. Here generalized lymphadenopathy and hepatosplenomegaly. It is caused by Epstein-Barr virus and is benign. That means you don't have to do anything, is it? Look at how infectious mononucleosis is looking. Let us look at this. Bring to front. The rash seen in mononucleosis is often non-specific and appears as red spots and bumps, also known as maculopapular rash. Here also they use the word maculopapular rash, right? What is there here? Infectious mononucleosis, glandular fever. In contrast to the isolated mononucleosis rash, the rash due to an infection caused by Epstein-Barr virus plus amoxicillin. So here they have given amoxicillin. So the rash has become more itchy. Okay, here they have given amoxicillin. So infectious mononucleosis, rubella and Roseola infantum by human herpes. This much we have seen as differential. It doesn't end here. We have to look at drug rash. A history of rash following up any drug. Some people can take a drug and they can have rashes, right? So it could be a drug related rash. Meningococcocemia. This is because of bacteria. Don't tell me this is some viral. Cock means what? Bacteria, cocci, such as meningitis, toxemic state of patient. Here there will be toxemic state of the patient. Okay. So what else? Oh, still it's there. Typhus. The rash is centripetal. The patient is very toxic in typhus. Let's look at this. So this is caused by what? There are so many types of typhus actually. Epidemic typhus, which is louse bone typhus. Then you have, which typhus are they talking about here? And here they are blaming the bacteria which is causing, that is rickettsia. So this rash is centripetal. Petal means what? It is trying to move to the center. Centripetal. Okay guys, then coming to Miliaria rubra. Prickly heat. Because of heat they can have, is it? So don't confuse heat caused rash as measles. So just check, okay? Pinhead sized erythematous papules over the areas where sweat glands are abundant. So you will usually see this in summer because of heat, and it will be usually over the area where sweat glands are in abundance. Okay, so that is a giveaway for you. If possible, you'll have to differentiate. Okay, so in this video, what have we looked at? Measles. We looked at basic things like it is caused by virus, RNA paramyxovirus. Its incubation period is around 10 days. It affects 6 months to 3 years old children more, but it can affect at any age. It's human to human transmission. It's a respiratory disease. The source is droplets. There are no carriers, no much iceberg phenomena. Communicability is 4 days before the rash and 5 days after. It is pathognomic features. You will have Koplik spots inside the mouth. Okay. Measles, rubeola. It is a natural history of disease. You will say there are 3 phases: prodromal, eruptive, and convalescent. Prodromal, what will be there, guys? Fever will be there. Koplik spots, buccal mucosa, maculopapular rash. Opposite the lower second molar, and then other sides in the mouth, there can be coryza, inflammation of mucous membrane. That's what we saw. Nasal discharge, redness of eye. So fever and some mucosa affected, remember. Then eruptive phase, you have the pink blotchy irregular macular erythema. It fades on pressure, and when then it darkens and blends into large red patches of varying shape and size. Then it becomes retroauricular rash area, where behind the ear, then neck, trunk, limbs, right? Face, they're talking, the neck, trunk, limbs are there, accompanied by cervical lymphadenopathy. That is the eruptive phase. Then convalescent phase we have seen. So you can see here the rashes have gone and they have left a light brown stain, pigmentation. There will be weight loss, weakness, complications, otitis media most common, giant cell pneumonia can be fatal in AIDS patients. If it it can cause vitamin A deficiency. There can be encephalitis. Late complication is subacute sclerosing panEncephalitis, SSPE. It is a universally fatal disease, myoclonic jerks, mental deterioration. Remember SSPE. Treatment, no specific is there, but you can isolate the person, give them antipyretic, antihistamines, nasal drops, cough sedatives, fluid, vitamin A administration, etc. If there is secondary bacterial infection, you can give antibiotics. Prophylaxis, you know, you have active immunization. We have looked at the immunization. It's a live attenuated vaccine from Edmonton Jarreb's strain. It is actually lyophilized powder vaccine which has to be reconstituted with distilled water or sterile water. Subcutaneous injection 0.5 ml. National immunization schedule recommends only 2 doses, 9 month and 16 to 24 month. Right? It is stored in the down part of the ILR. Measles vaccine is stored in the bottom part of ILR. That is ice-lined refrigerator. Measles vaccine has quite a few contraindications and complications. Continuing with measles, so we told you that there is active immunization. Passive immunization also is there with gamma globulins. This is for contacts, okay. Then diagnosis, how will you make? Clinically you can do, no need of any investigation, but if you do investigation, you can see leukocyte count is low, measles specific IgM antibodies are present, hemagglutination inhibition, ELISA you can do. You can isolate the virus from nasopharyngeal swab, etc., blood, etc. You can isolate the virus. If you want to do only, you can do all that. Otherwise, it's not required. You should be able to differentiate it from other conditions like Rubeola infantum by human herpes 6. You should be able to differentiate it from rubella, from infectious mononucleosis, and from drug rash, Meningococcocemia, and Typhus and Miliaria rubra, that is prickly heat rash, okay, Miliaria rubra. So all this you should be able to differentiate from. So we have looked at in this video what guys? Measles. Completely we looked at measles in terms of everything, right? Microbiology, PSM, pediatrics, everything we have looked at, community medicine, everything we have looked at in this video. This is measles virus guys. This is some RNA virus, Paramyxoviridae. It has helical nucleocapsid which contains RNA. Okay. You can see the structure here. And what does it cause? It causes measles, which is a communicable disease, which is a respiratory disease that spreads by droplets. You can see here measles, till here it is going. Right? So it is a viral respiratory disease which is a communicable disease. So that's all for now in this video guys. We'll meet you in the next video. Bye bye. Just remember people, measles vaccine is live attenuated. You should not give it in immunocompromised people, like if they have tuberculosis, HIV, if they have leukemia, don't give it in these people, okay? If they have history of convulsions, if they are already ill, don't give them this type of vaccine. It can cause complications like mild measles-like illness with fever and rash, convulsions, gastrointestinal upset, rhinopharyngitis, toxic shock syndrome. Just remember that you should not give it in immunocompromised people, okay? And what is a complication? It can cause mild measles-like illness, convulsions can occur, toxic shock syndrome and all can occur. That's why the reconstituted vaccine you should use quickly. Within 4 hours if I'm not wrong, but please check that, okay?